Hello, folks. How are you? This is Don Kelly here, physical therapist and acupuncturist. I hope you're all having a great Wednesday. Okay, I'm going to put up a quick vlog here and I'm going to discuss about hip and leg pain. So, if anyone out there is suffering from hip or leg pain, you might want to listen to this, or you might want to tag a friend who suffers this particular condition because it's very, very common. Okay, right. So, what is hip and leg pain? Where we're going to start is, there's not one particular cause or reason why a person would have hip and leg pain. There can be different reasons why one person would have this pain, and pretend and figuring out which is the root cause of the pain, which will determine on the type of exercise and stretch that a person can do to alleviate the pain. Now, there can be a number of different causes or reasons why a person would have hip and leg pain. Okay, one reason would be bulging disc, okay, which would be a disc problem or a problem in your lower spine from L1 to L5, that region there. If there's a nerve impinged, or if there's a bulging disc there causing a nerve impingement, that can refer pain into the hip and it can refer pain down to the leg. Another syndrome which can cause this particular type of pain is a sacroiliac joint pain syndrome. So this would be a bit lower down by the base of your butt, down right in between the lowest of your back. And if there's restriction or problems there, that can cause hip and leg pain. And then also there can be muscular problems in the gluteal muscles, in the piriformis muscle, in the glute muscles. And if there's trouble there, if they're weak or hypertonic or overactive, they can cause hip and leg pain also. Also, what can cause hip and leg pain would be missing. If you're walking and you miss a step and you walk off a step and you have a little jolt, or come off of a horse and your foot gets caught in the stirrup, or falling on your bum, that can create hip and leg pain as well. So that's generally a trauma, a physical trauma, and a lot of the time that will affect the lower vertebrae of the body, the sacroiliac joint, and if that gets jarred, that can refer a lot of pain into the hip and down the leg as well. Now, there's different characteristics of the pain, and I'll try differentiate them for you here, so it might give you an idea of how you can best manage it. Now, 90% of the time, if you do get pain in your hip or in the leg, it can heal, and it should heal. There's a good chance it will heal all by itself, and you will not need any medical intervention. You will not need any physio or anything like that. But if it's a case where it's not healing, if it's not settling, and the pain is persistent and constant, you should always get it checked out. Okay, always get it checked out, especially if the pain is not alleviating, and go seek some medical advice. Now, different types of pain. So if your hip pain, if you've pain in the hip and it's traveling all the way down the leg and into the foot and into the ankle, maybe with some neurological symptoms in the ankle, pins and needles, numbness. Not all the time, but a lot of the time this could be significant, a sign of there's a disc, nerve root disc irritant there at the vertebrae in the lower spine, okay? So that's generally, but not always, that would be the characteristic type of pain. It will run down into the foot, into the ankle. Generally on the outside of the ankle, people will feel this pain and discomfort. Not all the time, but a lot of the time that can be a sign that you have a disc issue there. And you wouldn't necessarily have to have back pain either, although some back pain will be present. In other cases, it won't. Okay, if your pain is going into your butt and it's going into your groin and maybe halfway down the leg, not quite as far as the knee, this is generally indicative of the sacroiliac joint. Also the hip joint. There's an issue there between the hip and the sacroiliac joint. So if you've that type of pain, there's an issue there. This is quite common in people who have a fall, who fall on their bum, who miss a step, who get their foot caught in a stirrup of a horse, or any kind of trauma, a fall or a bang on the hip or the leg. It tends to give that type of pain. And arthritic type of pain, then, if you have an arthritic hip, okay, that pain will tends to shoot down the whole leg. Okay, especially when it gets bad, especially when it gets chronic, the pain will go down with pins and needles and numbness in the severe cases, and you'll have the pins and needles or numbness or a neurological symptom which will run all the way down the leg into the foot. If you're at that stage, you need to go get medical intervention. You need to go see your GP. You need to go and possibly see an orthopedic surgeon with a view of getting a hip replacement, because that will not settle, especially if it's an arthritic hip. You will also find a lot of stiffness in the hip, and you'll find sitting down for long periods will aggravate it, and standing up from a sitting, you'll get a lot of pain as well. Walking initially will ease off, and then as you walk a bit further, that pain will increase as well. So that's very indicative of an arthritic hip, and that definitely needs surgical intervention, especially if it's gone to the stage where the pain is going down the leg and it's more persistent or more constant, but especially with neurological symptoms. But as I tell everyone, if you have neurological symptoms, pins and needles, numbness, loss of feeling, loss of power, especially if there's loss of power in the leg, should always get it checked out. It's not normal. So that's quite a red flag, loss of power, neurological symptoms in the leg, always get it checked out. So that's generally the type of pain you'll get there. The most common types of pain in the hip and the leg. The pain can go into the groin, is quite common, in the inside of the leg, goes into the groin. All that is indicative of the hip and the sacroiliac joint. So there's different types of pains which will manifest different types of treatment protocols. So if you have any of those pains, a lot of the time they'll ease up by themselves and they'll stop by themselves. If they don't, you will definitely benefit with physiotherapy or osteopathy, stretching exercises, activity. The worst thing you can do when you're in pain is to do nothing at all. So if you have hip or leg pain, you should always stay some bit active, stay moving, stay mobile, but it always should be a case where the movement does not aggravate the pain. If it's a case where movement is aggravating the pain and there's no let up, you need to rest it for 72 hours and then try it after that, and then try your movement. And if you can go walking and it's starting to help in ease, it will settle down over a period of time. If it's consistently aggravating it, you need to get it checked out and get some intervention there and see what's going on. Hamstring stretches can cause, if you start stretching your hamstrings, your piriformis muscle, your gluteal muscle, do some lumbar extension exercises. All those can help to alleviate low back pain or leg pain or hip pain, especially stretching out the hips. Just make sure any exercise that you do does not aggravate it. There should not be pain. You should not have any pain or any discomfort when you are stretching, when you are working these muscles. There should be no pain. So you should be able to stretch the hamstrings, the glutes, the piriformis, and even the quads and the adductors. You should work on stretching all those muscles and do some spinal extension stretches as well. And as I said, none of them should cause pain. There should be no aggravation of symptoms. Any exercise you do should give you alleviation. You should feel relief. You should feel better after the exercise, feel better during the exercise. If you find that when you're doing those exercises, continue to do them. Do them, hold them, the stretches for 20 to 30 seconds. Do the stretch on both legs and both hips. Repeat it 3 to 5 times each side, and try doing that morning, lunchtime, and evening time for your best opportunity getting some relief. Also, hot Epsom salt baths can be very good. Maybe 2 a week for a month. Okay, 3 cups of Epsom salts into a hot bath, as hot as you can take it, and just lie in that for half an hour, no longer. Drink plenty fluids before you go in, and drink plenty fluids before you come out, and that can help alleviate the pain as well. So they're all kind of some home exercises and some self-care exercises you can do at home to help alleviate the pain. But as I say always in my vlogs, pain is not normal. Pain is a signal that there's a problem with your body. So don't ignore it, okay? So it's important to find out the root cause, and it's only your therapist or your medical doctor who will find, who will be able to, through doing special tests and activities and stuff like that, which will be able to determine which is the best uh, uh, protocol or plan you can put in place for treating your pain. But if it continues, get it checked out. Don't ignore it, especially if it's long-term pain. And if the exercises you were doing are causing discomfort, causing pain, stop them straight away. Okay? Do not do any exercise through pain. All right? So that's some information there on hip and leg. I hope it's helpful for you guys. Any queries, email me, leave a comment in the box, and get on to me, and I will gladly get back to you and discuss any ongoing problems that you might have, and I'll try my best to help you. So look, that's everything there regarding hip and leg pain. If there's any problems, please, as I said, reach out to me, give me a call, any queries, I will always get back to you. But just remember, do not stretch or exercise through pain.